What is anorexia nervosa? Anorexia nervosa is an eating disorder in which an individual restricts intake, so that their body weight becomes lower, even lower than normal. These people have a preoccupation with their body weight and shape, and there is a fear of weight gain involved. Subtypes of anorexia nervosa. There are two subtypes of anorexia nervosa. 1. The restricting type. This is the type of anorexia nervosa when somebody has an intake that is insufficient to maintain normal weight, which means they are not taking enough to sustain a healthy life. 2. Binge eating or purging type. This type is confusing a lot to bulimia, and the binge eating purging type is where someone binge eats usually over a period of time, like an hour or 2 hours. They eat a lot of food and then they exhibit what is called compensatory behaviors. These compensatory behaviors include forced vomiting, misuse of laxatives, overexercising, using diuretics, fasting, etc. to get that weight back down. You might be thinking that this sounds a lot like bulimia nervosa, and you might be right. This is the reason why these two disorders are confused with one another. The severity specifier for anorexia nervosa is based on the BMI, and there are 4 severity specifiers with anorexia. This severity goes from mild to moderate, and all the way to extreme. What is bulimia nervosa? Now let's discuss bulimia nervosa. The person suffering from bulimia has a binge eating and purging cycle. There are periods where this individual overeats a lot of food, usually in a discrete time period, like a couple of hours, and then they exhibit compensatory behaviors. These compensatory behaviors include forced vomiting, misuse of laxatives, overexercising, using diuretics, fasting, etc. to get that weight back down. These compensatory behaviors are used shortly after the episode of binge eating with bulimia nervosa. There are also 4 similar severity specifiers in bulimia nervosa like anorexia nervosa. But unlike anorexia nervosa, in bulimia nervosa, the BMI is the basis of severity, but with bulimia, it is the number of times we see the compensatory behaviors. So, there is an episode of binge eating and afterward, these compensatory behaviors start, and the number of times we see those behaviors that determine the severity, all the way from mild to extreme, just as we see with anorexia nervosa. The episodes of these compensatory behaviors move all the way up to the extreme. We see different specific periods within 1 week or so.